1. Hypothyroidism can cause bradycardia. True or false? Answer: true. Rationale: hypothyroidism reduces metabolic rate due to low thyroid hormone levels, slowing heart rate and causing bradycardia, a key symptom requiring monitoring to ensure cardiovascular stability. 2. Type 1 diabetes is caused by insulin resistance. True or false? Answer: false. Rationale: type 1 diabetes results from autoimmune destruction of pancreatic beta cells, leading to insulin deficiency, not resistance, requiring lifelong insulin therapy for glucose control. 3. Hyperthyroidism is associated with weight gain. True or false? Answer: false. Rationale: hyperthyroidism increases metabolism due to excess thyroid hormone, typically causing weight loss, a critical symptom guiding diagnosis and treatment to restore endocrine balance. 4. Administering glucagon is appropriate for an unresponsive patient with hypoglycemia. True or false? Answer: true. Rationale: glucagon raises blood glucose by stimulating glycogenolysis, making it a critical intervention for unresponsive hypoglycemic patients to restore consciousness and ensure safety. 5. Adrenal crisis can be treated with intravenous hydrocortisone. True or false? Answer: true. Rationale: adrenal crisis, caused by acute cortisol deficiency, requires intravenous hydrocortisone to replace cortisol, stabilize hemodynamics, and prevent life-threatening shock. 6. Hemoglobin A1C reflects blood glucose control over the past week. True or false? Answer: false. Rationale: hemoglobin A1C measures average blood glucose over 2 to 3 months, providing a long-term indicator of glycemic control essential for diabetes management and complication prevention. 7. Hyperparathyroidism can cause hypocalcemia. True or false? Answer: false. Rationale: hyperparathyroidism increases parathyroid hormone, elevating blood calcium levels, leading to hypercalcemia, which requires monitoring to prevent neurological complications. 8. Insulin should be administered immediately before meals for type 1 diabetes. True or false? Answer: true. Rationale: rapid-acting insulin given before meals mimics physiological insulin release, controlling postprandial glucose spikes and preventing hyperglycemia in type 1 diabetes. 9. Cushing syndrome is caused by a deficiency of cortisol. True or false? Answer: false. Rationale: Cushing syndrome results from excess cortisol, often due to adrenal or pituitary dysfunction, causing symptoms like weight gain, requiring targeted endocrine interventions. 10. A patient with diabetes insipidus will have concentrated urine. True or false? Answer: false. Rationale: diabetes insipidus, due to antidiuretic hormone deficiency, causes dilute urine from excessive water loss, requiring desmopressin to restore fluid balance and prevent dehydration. 11. Levothyroxine is used to treat hyperthyroidism. True or false? Answer: false. Rationale: levothyroxine treats hypothyroidism by replacing thyroid hormone, while hyperthyroidism requires antithyroid drugs like methimazole to reduce hormone production. 12. Diabetic ketoacidosis is associated with elevated blood pH. True or false? Answer: false. Rationale: diabetic ketoacidosis causes metabolic acidosis with low blood pH due to ketone accumulation, requiring insulin and fluids to correct acid-base imbalance and ensure stability. 13. Pheochromocytoma causes excessive secretion of catecholamines. True or false? Answer: true. Rationale: pheochromocytoma, an adrenal tumor, oversecretes catecholamines, leading to hypertension and tachycardia, requiring surgical and pharmacological management for patient safety. 14. Hypoglycemia can cause seizures in diabetic patients. True or false? Answer: true. Rationale: hypoglycemia deprives the brain of glucose, potentially causing seizures, a neurological emergency requiring rapid glucose administration to prevent harm and ensure safety. 15. The pituitary gland regulates thyroid function through thyroid-stimulating hormone. True or false? Answer: true. Rationale: The pituitary gland secretes thyroid-stimulating hormone to stimulate thyroid hormone production, a key regulatory mechanism assessed in endocrine disorders like hypothyroidism. 16. Hyperaldosteronism can cause hyperkalemia. True or false? Answer: false. Rationale: hyperaldosteronism increases aldosterone, promoting potassium excretion, leading to hypokalemia, which requires monitoring to prevent muscle weakness and cardiac arrhythmias. 17. Patients with type 2 diabetes always require insulin therapy. True or false? Answer: false. Rationale: type 2 diabetes often involves insulin resistance, managed initially with lifestyle changes or oral medications, with insulin reserved for advanced cases to control glucose. 18. Myxedema coma is a complication of untreated hypothyroidism. True or false? Answer: true. Rationale: myxedema coma, a life-threatening hypothyroidism complication, causes hypothermia and coma, requiring urgent intravenous levothyroxine to restore thyroid function and safety. 19. A patient with hyperthyroidism may experience exophthalmos. True or false? Answer: true. Rationale: exophthalmos, or bulging eyes, occurs in hyperthyroidism, particularly Graves' disease, due to orbital tissue inflammation, requiring monitoring to protect vision and comfort. 20. Glucagon is secreted by the beta cells of the pancreas. True or false? Answer: false. Rationale: glucagon is secreted by pancreatic alpha cells to raise blood glucose, while beta cells secrete insulin, a distinction critical for understanding endocrine glucose regulation. 21. Diabetic neuropathy can cause numbness in the extremities. True or false? Answer: true. Rationale: diabetic neuropathy from chronic hyperglycemia damages nerves, causing numbness in extremities, requiring foot care education to prevent injury and ensure safety. 22. Desmopressin is used to treat Cushing's syndrome. True or false? Answer: false. Rationale: desmopressin treats diabetes insipidus by mimicking antidiuretic hormone, while Cushing's syndrome requires cortisol-lowering therapies like ketoconazole or surgery. 23. Hypoparathyroidism can cause tetany. True or false? Answer: true. Rationale: hypoparathyroidism reduces parathyroid hormone, causing hypocalcemia, which leads to tetany, requiring calcium supplementation to prevent neurological complications. 24. Blood glucose monitoring is unnecessary for patients with type 2 diabetes. True or false? Answer: false. Rationale: blood glucose monitoring is essential for type 2 diabetes to guide therapy and prevent complications, ensuring glycemic control and long-term endocrine patient safety. 25. Thyroid storm is a medical emergency requiring immediate intervention. True or false? Answer: true. Rationale: thyroid storm, a severe hyperthyroidism complication, causes life-threatening symptoms like tachycardia, requiring urgent antithyroid drugs and beta blockers to stabilize. 26. Acromegaly is caused by a deficiency of growth hormone. True or false? Answer: false. Rationale: acromegaly results from excess growth hormone, often from a pituitary tumor, causing enlarged features, requiring surgical or pharmacological management to control symptoms. 27. Insulin should be stored at room temperature for long-term use. True or false? Answer: false. Rationale: insulin should be refrigerated for long-term storage to maintain potency, with room temperature use limited to short periods to ensure efficacy and glycemic control. 28. Hypercalcemia is a common finding in Addison's disease. True or false? Answer: false. Rationale: Addison's disease causes cortisol deficiency, not hypercalcemia, which is more associated with hyperparathyroidism, requiring distinct endocrine management strategies. 29. Patients with diabetes insipidus require fluid restriction. True or false? Answer: false. Rationale: diabetes insipidus causes excessive fluid loss, requiring adequate hydration and desmopressin to replace antidiuretic hormone and prevent dehydration-related complications. 30. Methimazole can cause agranulocytosis as a side effect. True or false? Answer: true. Rationale: methimazole, used for hyperthyroidism, can rarely cause agranulocytosis, requiring monitoring of white blood cell counts to ensure patient safety and prevent infections. 31. Diabetic retinopathy is a reversible condition with tight glucose control. True or false? Answer: false. Rationale: diabetic retinopathy, caused by retinal damage, is not fully reversible, but tight glucose control can slow progression, emphasizing early intervention for vision protection. 32. The adrenal gland secretes insulin to regulate blood glucose. True or false? Answer: false. Rationale: the adrenal gland secretes cortisol and catecholamines, while insulin is secreted by the pancreas, a distinction critical for understanding endocrine glucose regulation. 33. Hypothyroidism can cause hair loss. True or false? Answer: true. Rationale: hypothyroidism reduces metabolism, affecting hair follicles and causing hair loss, a symptom requiring thyroid hormone replacement to restore endocrine balance. 34. Administering insulin to a patient with a blood glucose of 50 mg per deciliter is appropriate. True or false? Answer: false. Rationale: a blood glucose of 50 mg per deciliter indicates hypoglycemia, requiring glucose or glucagon, not insulin, to prevent neurological damage and ensure patient safety. 35. Prolactinomas are treated with dopamine agonists like cabergoline. True or false? Answer: true. Rationale: prolactinomas, pituitary tumors causing prolactin excess, respond to dopamine agonists like cabergoline, which reduce prolactin secretion and tumor size effectively. 36. Hyperglycemia can cause polyuria in diabetic patients. True or false? Answer: true. Rationale: hyperglycemia causes osmotic diuresis, leading to polyuria in diabetes, a symptom requiring insulin therapy to control glucose and prevent dehydration complications. 37. Hypophysectomy can lead to diabetes insipidus. True or false? Answer: true. Rationale: hypophysectomy, pituitary gland removal, can disrupt antidiuretic hormone production, causing diabetes insipidus, requiring desmopressin to manage fluid balance. 38. Type 1 diabetes is more common in adults than children. True or false? Answer: false. Rationale: type 1 diabetes, an autoimmune condition, typically presents in childhood or adolescence, requiring insulin therapy, unlike type 2, which is more common in adults. 39. Hyperparathyroidism can cause osteoporosis. True or false? Answer: true. Rationale: hyperparathyroidism increases parathyroid hormone, mobilizing bone calcium, leading to osteoporosis, requiring monitoring to prevent fractures and ensure skeletal health. 40. Patients with Cushing's syndrome are at risk for hyperglycemia. True or false? Answer: true. Rationale: excess cortisol in Cushing's syndrome impairs glucose metabolism, causing hyperglycemia, requiring monitoring to prevent diabetes and ensure metabolic stability. 41. Levothyroxine should be taken with food to enhance absorption. True or false? Answer: false. Rationale: levothyroxine is best taken on an empty stomach to maximize absorption, ensuring effective thyroid hormone replacement and optimal endocrine function. 42. Diabetic ketoacidosis can cause hypokalemia during treatment. True or false? Answer: true. Rationale: insulin therapy for diabetic ketoacidosis drives potassium into cells, causing hypokalemia, requiring potassium supplementation to prevent cardiac arrhythmias. 43. Adrenal crisis is characterized by hypertension. True or false? Answer: false. Rationale: adrenal crisis causes hypotension due to cortisol deficiency, requiring urgent hydrocortisone to restore hemodynamics and ensure patient safety in emergencies. 44. A fasting blood glucose of 126 mg per deciliter or higher confirms diabetes mellitus. True or false? Answer: true. Rationale: A fasting blood glucose of 126 milligrams per deciliter or higher on 2 occasions confirms diabetes, guiding management to prevent complications and ensure endocrine health. 45. Hyperthyroidism can cause atrial fibrillation. True or false? Answer: true. Rationale: hyperthyroidism increases metabolic rate, potentially causing atrial fibrillation due to cardiac overstimulation, requiring antithyroid therapy and cardiac monitoring. 46. Patients with diabetes insipidus have low serum osmolality. True or false? Answer: false. Rationale: diabetes insipidus causes excessive water loss, increasing serum osmolality, requiring desmopressin to restore fluid balance and prevent neurological complications. 47. Type 2 diabetes is primarily caused by autoimmune destruction of beta cells. True or false? Answer: false. Rationale: type 2 diabetes involves insulin resistance and relative insulin deficiency, not autoimmune beta cell destruction, which is characteristic of type 1 diabetes. 48. Hypothyroidism can cause constipation. True or false? Answer: true. Rationale: hypothyroidism slows gastrointestinal motility due to reduced metabolism, causing constipation, requiring thyroid hormone replacement to restore normal function. 49. Administering desmopressin can cause hyponatremia. True or false? Answer: true. Rationale: desmopressin increases water retention in diabetes insipidus, potentially causing hyponatremia, requiring sodium monitoring to ensure electrolyte balance and safety. 50. Cushing's syndrome can cause osteoporosis. True or false? Answer: true. Rationale: excess cortisol in Cushing's syndrome increases bone resorption, causing osteoporosis, requiring monitoring to prevent fractures and ensure skeletal health.